Welcome to this video on type 1 diabetes. My name is Nimota. I'm a hospital pharmacist in the UK, and today we'll be exploring this important autoimmune condition. Before we start, here are a few questions to test your baseline knowledge on this topic. Feel free to pause the video and attempt the questions first. You can test your knowledge again at the end of the video, where I've linked a revision worksheet. Research shows that comparing your knowledge before and after learning significantly improves retention. Now let's move on to the video. We'll be covering the causes of type 1 diabetes, how it presents, and how we can manage it and its complications. To give you a brief definition, type 1 diabetes is an autoimmune condition where the body's immune system destroys insulin-producing beta cells in the pancreas. This results in insufficient or no insulin production, leading to elevated blood glucose levels. Type 1 diabetes is usually diagnosed in children and young adults, although it can occur at any age. There's a genetic predisposition. If you have family members with type 1 diabetes, your risk also increases. Environmental triggers may include certain viral infections, and this can also play a part. And it accounts for approximately 5 to 10% of all diabetes cases worldwide. The disease process involves 4 key elements. Autoimmune destruction of pancreatic beta cells. Essentially, the body attacks its own insulin factories. This results in absolute insulin deficiency. The body simply can't produce the insulin that it needs. Without insulin, the body becomes unable to regulate blood glucose levels. This leads to hyperglycemia. Insulin is crucial because it allows glucose to enter cells and be used for energy. Without it, glucose remains in the bloodstream, causing damage over time. So, how might someone present with type 1 diabetes? There are several classic symptoms to watch out for. Excessive thirst that seems unquenchable. Polyuria, frequent urination, including waking multiple times at night. Polyphagia, increased hunger, often despite eating normal amounts. Unexplained weight loss, which can be quite rapid. Fatigue and weakness that interferes with daily activities. And blurred vision due to glucose-related changes in the eye. When it comes to diagnosing type 1 diabetes, here's what's recommended by the UK NICE guidelines. A fasting plasma glucose of greater than 7, a random plasma glucose greater than 11.1 with symptoms, HbA1c greater than 48 millimoles per mole. HbA1c is an indicator of the average blood glucose level over 2 to 3 months. The presence of specific autoantibodies indicates an autoimmune attack, and this is another sign of type 1 diabetes. Managing type 1 diabetes requires a comprehensive approach. The cornerstone of treatment is insulin replacement therapy. Blood glucose monitoring also plays a very important part, and there are also lifestyle modifications that can be made. Insulin replacement therapy can be delivered in a couple different ways, usually through multiple daily injections using insulin pens or syringes. However, some patients use an insulin pump that delivers continuous insulin. There are also a couple different types of insulin, ranging from rapid acting to long acting, but we'll look at these more closely in a further video. Blood glucose monitoring is also essential and can be done through regular finger prick tests using a glucose meter or continuous glucose monitoring systems that provide real-time data. Lifestyle modifications also play a crucial role. Carbohydrate counting is done to match insulin doses to food intake. Regular exercise improves insulin sensitivity, and a balanced diet is also important to support overall health. People with type 1 diabetes need to be aware of acute complications that require immediate attention. Firstly, we'll take a look at hypoglycaemia. This is when blood glucose falls below 4 millimoles per liter. Early symptoms include sweating, trembling, anxiety, and hunger. However, this can progress to confusion, weakness, and difficulty concentrating, or, in worst case, seizures or loss of consciousness may occur. Treatment involves consuming 15 to 20 grams of fast-acting carbohydrates and rechecking glucose after 15 minutes. For severe cases, glucagon injection may be necessary. Patients are advised to eat a regular meal shortly after the blood glucose levels return to normal to ensure they are maintained at that level. The second complication we'll look at is hyperglycemia. This is when blood glucose is over 11.1 millimoles per liter. However, I have seen them much higher in practice. Symptoms include thirst, frequent urination, and fatigue. Hyperglycemia can often be caused by insufficient or poor insulin management, illness, stress, and sometimes diet. To treat hyperglycemia, patients will require adjusting doses of insulin and adequate hydration. Finally, we have diabetic ketoacidosis, DKA. This is a life-threatening emergency. It's characterized by severe hyperglycemia, ketones in the blood or urine, and metabolic acidosis. Symptoms include nausea, vomiting, abdominal pain, and deep, rapid breathing. This requires emergency treatment with IV fluids, insulin, and electrolyte management. With time, uncontrolled diabetes can lead to serious complications. Microvascular complications affect small blood vessels. Retinopathy can damage the eyes and potentially lead to blindness. Nephropathy affects the kidneys and may progress to kidney failure. And neuropathy damages nerves, causing pain, numbness, or dysfunction. Macrovascular complications affect the larger blood vessels. Cardiovascular disease can lead to heart attacks and strokes, and peripheral vascular disease can affect circulation to the limbs. The good news is that maintaining good blood glucose control can significantly reduce the risk of these complications. To summarize, type 1 diabetes mellitus is a complex autoimmune condition requiring lifelong insulin therapy, regular monitoring, and lifestyle adaptations. With proper management, individuals can lead healthy, fulfilling lives whilst minimizing the risk of both acute and chronic complications. If you found this video helpful, please like and subscribe for more healthcare and pharmacy content. Remember to test your knowledge using the free revision worksheets I've linked in the description. All the answers can be found in the video. Thanks so much for watching, and I'll see you in the next one.